I think let's move to the lightning round next. Nicola, Giovanni, Patty, and Peter, I haven't forgotten you. We will also come to you in the lightning round. So I would ask all of the speakers, and we'll go in the same order as with the panel. If you could please share your main recommendation or two for advancing social listening for public health. If you're giving the community sort of a work marching orders for what we need to do in the next year to increase public health and social impact of in social listening, what would you recommend? What to advance social listening for public health? So, John, over to you. What would be your thoughts?
Yeah, I think one of the things that I'm learning from being in the U.S. context is that regulation is going to matter. And so if we can put forward multiple bills and advocate for multiple regulatory agencies to standardize access, at least if we know what we can get, we can design our science and interventions around that. But until that time, it's going to always be this piecemeal approach. And so that to me is one of the ways forward, is to just advocate for standards and to ensure that at least the data that we get is comprehensive and regular. The other thing I would suggest is looking outside the internet, which is to say that it's very promising to hear that people are working on transcriptions of radio broadcasts. I would also add in that the Internet Archive does have some access points to Chiron research, so you can look at what's at the bottom of news and get a sense of like what kind of trending topics were happening that day and in which areas. And then the last thing I would say is that we could also work on our Prebunk messaging, which is to say that when we know certain misinformation things are going to come up, we need to orient strategies around ensuring that when the public hears about that misinformation first, that they are equipped with an action point that allows them to either figure out, you know, where they would go for more information or if they should just dismiss this rumor. So that's 3 things, but I appreciate everybody being here. Thanks.
That's great. It's also it's very nice. Thank you, Joan. Dimitri, what about you? What would be your recommendations going forward?
All right, so it's a great question. You know, I think one thing in working with my colleagues in the more med-epi sort of, you know, area is understand that there is no magical pill for mistrust. I think a lot of times people in public health are looking for like biomedical solutions to public health problems. And in this case, trust is embedded in community engagement and trust. So I think like when I think about CDC's role, when I think about our global public health community, it's this connection to communities and strengthening those and moving beyond the kind of biomedical model in that regard, I think is going to be really crucial. I also second the need for this sort of policy framework that will be incredibly useful to, you know, create the structure for, you know, strategic investment of resources into things that we've discussed in terms of capacity, human capacity, in terms of the sort of systems and structures that, you know, need to exist. And I'm hoping that one silver lining of this pandemic is that there's a wokeness in the global community as to the fact that, you know, this is unfortunately not likely to be the last pandemic we deal with in our lifetime. So, and we're seeing what's happening with the variants and everything else, and that this is going to be an ongoing issue, and it's just not going to go away. And then the final thing I'll say is this importance of a community of practice and research. I think Peter and Patty, they mentioned the Africa Infodemic, you know, Response Alliance, and these kind of country-to-country learning platforms are going to be really crucial as well to really make sure that what is being developed is country-led, is really self-determined to a large degree, and that the global community and regional community can best be supporting that and providing, you know, guidance and help with distilling best practices, but this need for community and for in-country leadership will be really crucial. So I'll stop there. Thanks.
Great, thank you, Dimitri. You're also basically touching the points of building systems and capacities beyond what beyond on the health system. So I really appreciate that going forward. Miguel, what are your thoughts?
Yeah, I mean, I was thinking at two scales. I guess that on my recommendations on the one very practical applications, I mean, going to operational impact, I think it's time, as I was saying, for more projects that include public health, behavioral science, and computational science. So I guess that these three pillars can have an end-to-end use cases where we go from, I mean, understanding really the data collection to the impact. At the other level, I agree with my colleagues. I mean, regulation is coming. It's coming not particularly from the medical sector, but it's coming from other places. I mean, the European Union just launched the first proposal for regulation on artificial intelligence that's going to impact, I mean, regulation around medical science. The US is getting another one. I think it's important from each one from our places to try to influence those regulations so there is not a huge fragmentation. Something that happened previously around privacy, and I do think, I mean, right now at the global scale, we are still trying to amend a very fragmented space around what is privacy or the rights to privacy of citizens. So I think now is the moment where all these regulations around AI are happening, and either from the social media platforms perspective or from other fields, all these are going to touch, I mean, the infodemic sector.
Yes, totally agree. Thank you, Miguel. Eva, how about you? What would be your recommendations?
Yeah, great. I do agree with the other panelists. I guess I think advancing social listening will sort of like require to ensure that it is embedded in broader coordination mechanisms that strengthen community-centered approaches and that are collaborative and that are consistent. And the related systems and plans, they need to be flexible and adaptive and also ensure that the accountability that the data is being used. So I would like to come back to the need for triangulation. So really, it is important to ensure that real-time social listening data is combined with community feedback and other social behavior research to inform community engagement strategies and influence response actions as well. Which is responsive to those insights. And this will also require to strengthen diverse partnerships and multidisciplinary coordination. Thank you.
Yes, absolutely. I think we're starting to see us sort of painting the fuller picture now. Andreas, in a reflection during the intervention in the panel, what would be your one or two recommendations for going forward?
Yeah, I think my main takeaway would really be the need for sort of an international code of conduct or international guidance that people, you know, doing social listening could be adhering to. And this is something definitely that WHO should be exploring together with, for example, our network of clearing centers for ethics, of which Zurich, headed by Nicola Biller, is one. I think we have a number of centers who could contribute that. I just put a related guidance document from WHO on public health surveillance. And there it's related. It's really not very specific, but that's how, yeah, that's sort of the closest we get. And I think it shows that there's really quite a gap in this area from WHO's side to be filled. Over.
Thank you, Andreas. Well, then I look forward to about this going forward. Nicola and Giovanni, what would your recommendations be for for actions going forward to strengthen social listening.
Thank you. This was really fascinating to listen to. And whereas I, of course, do see the need for, targeted interventions in certain cases to try to affect people's behavior, I would still like to remind us that discourse and participation are key to sustaining trust and also to avoiding polarization in closed groups. So I think there needs to be a complementary strategy. Sometimes you need to be targeted and really trying to affect people's behavior in a crisis situation, but also don't forget the bigger picture of trying to encourage discourse, informed choice, literacy, and all of these, maybe larger concepts that should not get forgotten even in a crisis situation.
And maybe just adding to that, there is no magic pill for sure for this kind of issues. There is no one size fits all solution, but for sure we can really leverage on transparency, and we can really leverage on community engagement, on making this switch from thinking to people, to citizens as subjects of research, and starting to consider them as co-actors in research and in public health practices, not only in policies. And I think that's the starting point. And for sure, then we need to consider these in a longer temporal horizon. So start doing, now we are like working on the verge of the crisis, but we can and we should start doing some long-term planning in terms of preparedness. Building on this and what we learned, and on the momentum, on the attention that there is on these topics right now.
Thank you, Giovanni. Yeah, I really do appreciate this linkage between transparency, community engagement, and aspects going forward. Patty and Peter, you're the last one to reflect. What would your recommendations be?
Okay, thank you. Thanks, Tina. Lovely discussion. A couple of quick things. A key issue for me is working out how to integrate online and offline data. And there's some great examples. For Mafindo in Indonesia, there's a huge amount of digital tracking. They've also got volunteers in, I think it's 24 different districts of Indonesia. And so they track all the numbers of tweets and whatever. And then once a week, people from all of them actually say, this is what's having traction in our community. And it's that personal interaction of what's going on the ground that actually sets the agenda. Another point, picking up from what Eva was saying around community engagement. See social listening not just as a communication interaction, but as a way to understand what the real concerns are, that if they're addressed, that's what builds trust. To misquote Simon and Garfunkel, there's a risk of people hearing without listening. We keep hearing what is being said there, but if we don't internalize that, understand that, and actually respond, then we're missing the point. If you've got your partner, a boyfriend or girlfriend, and you say to them, I don't trust you, you lie, you're lying to me. And the response is, oh no, saying, oh no, nice words, and of course I don't lie, it's nice. That doesn't mean a thing. It's only if people change their action in response to what they've heard that can build the system, build trust, in this case in the health system. So see social listening as a way in to find what the problems are that the health system needs to address. And then just the last one, there's a real issue for the researchers to get an evaluation metric. I do not know how to prove that all the effort we're doing in social listening actually leads to a health outcome. And until we do that, we're playing with tools. We're playing with new exciting tricks. We don't have something that can be fully integrated into the wider health system without all these other individual efforts at the start. We need an evaluation framework to actually demonstrate the value of what we're doing. Thank you.
Thank you, Peter. And maybe 30 seconds for Patty.
No, and I would just echo that, you know, a lot of, I would say there's like a larger picture, and we're all sort of operating in different pieces of a larger picture. And I would just say it's important to be very aware of the larger picture, and then where, you know, either your piece of whatever data it is that you're looking at, and or whatever program it is or behavior you're trying to change, you need to have the full picture in mind as you are embarking on whatever journey it is. Otherwise, we risk leaving out entire segments of the population, and or doing a disservice. So really going back to sort of like the responsible approaches, et cetera, to just make sure that we're doing this in a very sort of holistic, integrated, and responsible way.
Thank you, Patty, very much. And thank you, everyone, all of the panelists, and for all of your very interesting interventions, and everyone that has been contributing questions. So I'm mindful of the time. Chris,